To operate as if all our clients were the same is not based on reality, and it can result in unethical and ineffective practice. Culture is complex. Becoming multiculturally competent is the developmental process that requires continual education and training. In addition, counselors must recognize their limitations and seek consultation, seek continuing education, or make referrals to a professional who is competent to work with a particular client population. In your book on page 116, they have the case of Cynthia. Let's review that case as an example of a culturally encapsulated counselor. Sage has recently set up a private practice in a culturally mixed neighborhood. Cynthia comes to Sage for counseling. Cynthia is feeling depressed. Life has little meaning, and she feels enslaved by the needs of her husband and small children. She tells the counselor that she has talked to her husband about a desire to return to school and to pursue a career. Her husband threatened a divorce if she followed through with these plans. She then went and consulted with her pastor, who pointed out her obligations to her family. Now, Sage is aware of his own cultural biases, which include a strong commitment to family and to the role of the man as the head of the household. Although he's feeling empathetic for Cynthia, he persuades her to postpone her own aspirations until her children have grown up. She agrees to do this because she feels guilty about asserting her own needs and doesn't want to be left alone by her husband. Now, the bottom line of this scenario is that the counselor ignored her aspirations. Cynthia spoke with two significant people regarding what she wanted to do, and both of them, her husband and her pastor, rejected her goals. Now her counselor is the third person that has also done this. A more ethical approach would be to provide a supportive environment in which the client could explore her struggles without the therapist imposing his agenda on her. Sage's ethical duty is to listen to Cynthia's aspirations without judgment and to respect her struggle in her journey towards finding her own answers. Earlier, we talked about how a lot of our contemporary theories of therapy and therapeutic practice are really grounded in the individualistic assumptions of our mainstream U.S. culture, the Western culture. Some of these values include things like autonomy, self-determination, and becoming your own person. Be aware of this and carefully consider whether these values really fit the clients that you're seeing from other cultures. We have to be aware of and sensitive to all cultural realities. If we don't, we can cause harm to our clients. There are some assumptions that we need to look at in order to make sure that we are counselors with a pluralistic viewpoint. Now, we know that we need to be very aware of what our own values are so that we don't impose them on our clients, just like Sage did with Cynthia. There are some assumptions that could be different for different cultures. For example, there's the assumption that self-disclosure on the part of the client is essential for a therapeutic process to work. However, some would contend that this assumption ignores the fact that in some cultures, self-disclosure is taboo. There is also an assumption that self-disclosure is a characteristic of a healthy personality. But remember, in some cultures, it's unacceptable to reveal personal problems because it could reflect on the whole family. So instead of being repressed, inhibited, passive, or shy, which might be the label we give these people that are from a different culture, maybe they're just holding true to their cultural background. Counselors need to understand that there are many different ways for clients to make themselves known without talking about their private aspects of their lives. Another assumption is assertiveness. Most counselors assume that clients are better off if they can behave in assertive ways. So, we often try to teach them these skills. Certain traditional counseling practices may act as barriers to effective multicultural helping. What if being assertive is not appropriate? So, for example, if you're working maybe with an Asian woman and she's got issues with her father, and you say, well, you just need to be assertive and tell your father that this is how you feel and this is what your needs are. Well, that could be a disaster in that culture and could cause irreparable damage in their relationship. Another assumption made by counselors is that it's important for the individual to become a fully functioning person. This change by the client may have significant implications on other people in that person's life. There may be a cultural responsibility to a group. Mainstream Americans are more likely to form quick relationships and talk more readily about their personal lives than do other cultures. In many cultures, this takes a really long time to develop, and a counselor can assume this is resistance. Many cultural expressions are subject to misinterpretation. Personal space, eye contact, handshaking, dress, formality of greeting, perspective on time, etc., etc. Americans are most uncomfortable with silence and tend to talk to ease the tension. In some cultures, silence may be a sign of respect and politeness. It's important to pay attention to subtle changes in nonverbal communication by the client so that they're able to understand the true meaning of silence. For example, with direct eye contact, this could be seen as intrusive by some cultures. In Euro-American middle class, it's considered a sign of interest and presence. Native Americans and Hispanics, eye contact is a sign of disrespect. Directness or assertiveness may be a sign of being rude in some cultures. The American Psychiatric Association in 1973 and the American Psychological Association in 1975 stopped labeling homosexuality as a form of mental illness. Therapeutic practices have been modified to reflect this viewpoint. Discrimination of any kind, race, ethnicity, gender, sexual orientation, is unethical and unacceptable. Check your values and attitudes concerning homosexuality. Unless counselors are conscious of their own faulty beliefs, they may project misconception and fears onto their clients. This also applies to counseling a gay parent, a child of a gay parent, a gay or lesbian couple, etc. Lesbian, gay, and bisexual clients have special counseling needs. Issues come up like struggling with concealing their identity and coming out, how to deal with family members concerning this issue, the loss of friends due to AIDS and other illnesses, fears of becoming HIV infected. Are you comfortable dealing with these issues? You need to be willing to explore any concern that the client brings to the counseling relationship. Counselors who don't possess knowledge about a specific group are ethically required to seek supervision and consultation, make a referral to a trained professional, receive specialized training about this population. Be careful not to provide care outside your expertise, scope of practice. Seek continuing education and workshops. As previously mentioned, your chapter has a really good discussion on the culture of disability. People with chronic, medical, physical, and mental disabilities represent the largest minority and disadvantaged group in the U.S. People with disabilities are part of the misunderstood culture because they do not conform to the socially accepted standards of normalization like beauty, physical attractiveness, and being able-bodied. War heroes may fit into this category. With all the wars that we've had, this is an issue that has come to light and needs to be addressed. Understanding the individual's cultural identity and how the client perceives his or her abilities is key. It's important for counselors to understand that they may be dealing with clients who struggle with low self-esteem and have been experiencing discrimination. There's always been the question of, does the counselor and the client have to share the same experiential world to be effective in a therapeutic process? Research has shown that when the counselor and the client connect at a certain level, regardless of culture, age differences, anything that's there, all these differences can be transcended. Don't be afraid to face the differences. In order for counselors to work with clients who differ from them in gender, race, and culture, they must have training in multicultural and social justice perspectives, both experiential and academic. Have an agreement with the client to develop a working therapeutic relationship. Be flexible in applying theories and techniques to specific situations. Be open to being challenged and tested. Your clients may exhibit suspicion and mistrust at first. So for example, in one of my classes, I had an African American student who told us that she was taught that white people deliberately send aids to Africa to kill them all off. So if this client who come to the United States to go to school was told that all her life, she would obviously have some mistrust of white people. If you become defensive, you're going to lose your client. Be aware of your own value system. Counselors must be aware and develop self-understanding of how their values, feelings, attitudes, and biases influence their work with these different populations. Participate in education. Make referrals when appropriate. Be competent in the work that you do. Students should become involved in self-exploratory classes also. Start even at that level. Take a course in multicultural issues. Multicultural perspectives should be integrated throughout a student's curriculum. Ongoing professional development related to multicultural counseling is critical. Go out into the community. Interact with different populations. Be open yourself with other cultures through reading and travel. Any experience that can sensitize counselors to life experiences and cultural values will contribute to their effectiveness as counselors. Take small steps. You can't learn it all at once, but make it a career process.